Good morning. It's been a long day already. Good morning, Queensland, and it's lovely to be with you today. And can I say, in very good news, we have 0 community cases, and we only have 1 case in hotel quarantine, which is wonderful. We have 30 active cases. We've had 13,591 tests in the past 24 hours. And 20,447 vaccines were administered by Queensland Health yesterday, which is fantastic news. So 48.25% of eligible Queenslanders have had 1 dose, and 29.45% have had 2 doses. So it's now been around 20 days since we've had a case active in the community, and once again, Queenslanders have done a great job protecting each other. So, in some further good news today, we are going to be easing our restrictions even more. So what does that mean? It means you can have 100 people in your own home, 200 people can attend weddings and funerals, or 1 person per 2 square metre rule. For the young people, dancing is back. Cafes, clubs and restaurants and pubs like the Regatta, where we are here today, and it's great to be at the Regatta, can double their capacity to 1 per 2 square metres, which is fantastic news. And I know that the industry has been looking forward to this day. And of course, these restrictions ease from 4 p.m. this afternoon. Stadiums can have 100% capacity, but patrons must wear a mask going in. They must wear a mask seated unless they're having a drink or they're eating at their seat. And indoor events like theatres, university lectures can have 100% capacity. And of course, we know community sport is well and truly back. However, Queensland, these masks are going to be still really, really important. So, of course, if you're outside, that's not a problem. But of course, going into cafes and restaurants, you need to wear your mask. You must also check in. Remember that check-in is really important for us in case we do get an outbreak of Delta sometime. But these masks are a protection for us. So our high school students will also still need to wear these masks. But what I'm going to do is we will review these mask requirements every 2 weeks. But this is an added protection for us. So I really want to make sure that we're doing everything we can in case we do get that outbreak. We do know it's on our doorstep in New South Wales, that there are still flights that come in. So we want to make sure that we are protecting everybody and doing the right thing. So that's excellent news today. Well done, Queensland. You've done a mighty job, and I'll hand over to Dr. Young.
Thank you, Premier. Yes, it is fantastic news. So no community cases, and that means we can go back to those restrictions that we had before we had our last outbreak. So we had 146 people involved in that last outbreak. Going forward though, because of what we are seeing going on in New South Wales, particularly very close to our border, it is important that we just maintain some restrictions. So the main one being masks, that if people could just continue to wear them how you've done so brilliantly over the last few weeks and even months. Just wear masks when you can't socially distance, particularly indoors. The risk is far less outdoors unless you're in very big numbers, which is why we're still asking people to wear masks in stadia. But outdoors otherwise, pretty good. But indoors, if you could wear a mask, except when you're, of course, eating and drinking. That's important, just as we go forwards while there are still those increasing numbers of cases across the border in New South Wales. Thank you.
Thanks, Premier. It's great to be coming to you live from Brisbane's iconic Regatta Hotel to be announcing a further easing of restrictions here in the South East. We are only able to be in this fantastic position thanks to our health response as well as our restrictions on the borders, both the international borders and those with New South Wales, the ACT and Victoria. Our pubs, clubs, cafes and restaurants have been doing it tough, and this is going to be a beautiful weekend here in Brisbane and the South East. So we'd again encourage everyone to get out, to have a coffee, a beer, order lunch or dinner. It's a fantastic weekend to be able to enjoy our weather and our city and our region. Queenslanders have worked too hard to get to where we are right now, to surrender with the end so close in sight. And so those border restrictions are critical for us, for allowing us to continue to have the kinds of freedoms that we have, that people in other cities and states can only dream of. We do, though, acknowledge that the border restrictions have an impact, a disproportionate impact on those that live on the border, particularly the New South Wales and Queensland border. And I'm really pleased to report that we've had an approach from the Deputy Premier of New South Wales to work with them to collaborate on border arrangements so that we can reduce the impacts of them on their community. You'll recall that not long ago the Premier wrote to the Premier of New South Wales and asked for that collaboration. At that stage it was declined. However, we certainly welcome this change of heart, this approach from the Deputy Premier of New South Wales to work with us, and of course, we will work with them to put in place whatever measures we can to both keep the border safe but also minimise its impact to the extent that it is possible. I also welcome news, a media release that I've just seen, that the Commonwealth have appointed a contractor to construct their national quarantine facility at Pinkenba. This is welcome progress, and we certainly look forward to them finally constructing this facility. It will come online after our 1,000-bed facility at Wellcamp, and between the two that will allow us to gradually phase down our reliance on hotel quarantine.
Well done, Queensland. It's been some weeks now since the 11 LGAs have been able to have these low level of restrictions. So the first time in some time, all of Queensland will be able to do the same things. Dance at venues, and I'm looking at a sign in front of me that says dancing not permitted in this venue. Well, from 4 p.m. this afternoon, dancing is back. People will be able to stand up and mingle at venues. They will be able to eat and drink standing up. Of course, we will have full stadiums again, and we will have more people in your home. An unlimited number of people can gather in public spaces. So this is fantastic news, and it's all because of our health response and because Queenslanders have worked together to make sure we've done the right thing. So keep doing the right thing. wearing your masks indoors, wearing your mask when you can't socially distance, having the mask on you at all times, and of course good hand hygiene, and most importantly, getting tested if you have any symptoms whatsoever anywhere in Queensland, and of course all Queenslanders coming forward to get vaccinated. Good news overnight, we have seen no positive cases come out of our testing in Palm Island, and we're continuing that testing again today, but all signs are very positive at this stage. So well done, Queensland. Everyone's getting rewarded at 4 o'clock this afternoon, and it's just wonderful that we are back to having some of the lowest restrictions in the country right now because of everyone's great work.
Thank you, Premier, and good morning, everyone. Just some statistics initially, and then I'll make some further comments. So we had some 6,268 vehicles. That's a combination of heavy freight as well as vehicles across the border, and 185 refused entry. The pause has been extraordinarily important for us to manage the hotels, and whilst the hotel numbers are slightly over 5,000, that recently has been as a result of internationals, but our average each day for domestics was around 300, and last overnight that was down to 113. So that has really worked. So the pause has had the effect that we needed to have, and obviously will give us some time to make sure that we can do that safely and without risk into the future. I wanted to just comment on a few people that have entered into Queensland, some 12 people, 2 families and 4 individuals who have entered obviously against the CHO's directive and without a border pass. These people have been heavily fined, obviously, for coming in against the directive, and also for not obeying a direction, an additional fine for that. And now if they remain in hotel quarantine, obviously that is a cost as well. So per person, that can be close to $9,000 if you are not doing the right thing. Thankfully, most people are, and I thank them for that, because certainly from our perspective, and I know also from health's perspective, that pause is incredibly important. I also wanted to give thanks to the ADF, who are working very, very closely with us on the border. That is a force multiplier. It enables us all to do more things. As a result, we will be obviously putting resources, as will New South Wales, on the weekend to the border. If there are protests, which we are expecting, we have great relationships with our protest groups, and we negotiate outcomes with them, and we are fully supportive of peaceful protests. I ask that that happens again, if that is the case this weekend, and that you work with us, but certainly from my perspective and New South Wales Police, there will be high visibility of police at the borders this weekend to manage those protests. Thank you.
Thanks, Commissioner. Happy to take some quick questions.
Can you clarify the mask rule, please, Premier? Is it?
Yeah.
So indoors, mask compulsory?
Indoors when you're going in, and then when you're leaving. But if you're seated and you're eating and drinking, you're fine. Or if you're walking around with a glass, that's fine as well.
Like in cinemas and stadiums, masks compulsory there?
Yes. Yeah.
Premier, the Deputy Premier mentioned the change of heart in New South Wales on...
Yeah, that was really interesting to see. I mean, that's great. And if the Deputy Premier is happy to talk to their Premier about it, we're happy to talk to them about it. So we've been very forward in putting forward our option. So let's see what happens.
So what's potentially on the table? How would that work? Is this around the Tweed area?
It was the river as being the border. Yeah.
The question from our Gold Coast office,
Yes.
they've said that there are a lot of business owners and people in Coolangatta have been asking for you to come down and witness the impact of the economic cost.
Yeah.
Are you willing to go down to
Yeah,
speak to people in
we've
Coolangatta?
got Parliament next week, but what I've done today, this morning, is I asked my small business minister to go down, so she's actually down there at the moment.
What about yourself?
Sorry?
What about yourself? Would you be willing to go down and meet with the people? That's what they're asking.
Yeah, look, but I can't go next week. I've got Parliament, so when I get an opportunity, and National Cabinet's on Friday, I'll go down there. But I've sent already my police minister's been down there, and of course my small business minister's down there today.
Premier, you said the mask restrictions are going to be reviewed every 2 weeks.
Yes.
What are the factors that are going to be considered, and
Look, these masks. Yeah, thanks, Jack. Look, these masks are really important, Queensland. So especially in the southeast of our state, because that's where our hotel quarantine is. That's where our flights are coming in and out of, and of course that's really close to our border. So the masks are really important. Of course, if you're outdoors, that's fine. But if you're queuing somewhere outdoors and you can't socially distance, put your mask on. And of course, when you're going into like supermarkets and everything, the masks.
What are you considering when you're doing that review?
Well, we'll just review it if there's any updated information. And of course, I've been very strong on our high school students wearing the masks. And as we know, you only have to look at the evidence, what's happening overseas. This is, at the moment, the pandemic of the unvaccinated. And until, we can look at the plan to get our high school students vaccinated, it's going to be really important for these masks.
Given you say how much it's going to cost taxpayers, how do we know it's good value for them and not just great?
Well, I'll tell you now, it's cheaper than the Victorian model, it's probably cheaper than the Western Australian model, and it's probably going to be much cheaper than the Commonwealth Building to Pinkenba model.
Should you have out of courtesy told the mayor?
Sorry?
Should you have out of courtesy?
My understanding is the Deputy Premier did contact the mayor. The Director General did,
what
yes.
Airlines has the government contacted with regards to landing at Wellington, and what's their response been?
Well, we were up there yesterday, Jack. I'm sorry you couldn't make it, and Cathay Pacific had flown in there. So it is an international
But
airport.
have you approached Qantas yet, and other airlines about landing there?
Well, I don't personally have to approach them. I'm quite sure that charter flights are allowed to land into any international airport. And like I said yesterday, if you build it, they will come.
Well, what about the
Prime Minister was quite
presented?
dismissive. The Prime Minister was quite dismissive of it yesterday and said you could have started this months ago. What's your response to it?
We did all the detailed planning, and if they agreed to it months ago, it would have been built by now. So anyway, we're getting on with the job. As a Queenslander, we're getting on with the job. And can I thank Queensland? The support out there has been overwhelming. It has been overwhelming into this about this regional quarantine facility.
Premier, you ended the line on the hotel quarantine facilities, and we paused hotel quarantine for 2 weeks. Do you consider yourself a Queenslander first or an Australian first?
Both. I've answered that question before, Jack. I think you may have even asked it.
I haven't.
Well, someone else has. I consider myself both. I'm an Australian, I'm a Queenslander, I'm the Premier of Queensland. I back Queensland every single step of the way, and I'm so proud of the job that Queenslanders have done.
Correspondence with the Prime Minister's
Guess what?
Premier.
I can't answer 5 questions at
What
once.
are we doing to help southern states, to help New South Wales, to help Victoria?
Yeah, my understanding is as part of that, just like in natural disasters, we all help one another out. My understanding is that health is helping out when required as well. So we do that automatically. This is
tracing.
Yeah. Whatever helps required, we help out.
Premier, you said the Wellcamp proposal will be cheaper than the Pinkenba site, cheaper than
Yes.
hotel quarantine arrangements at the moment. Will that end up being a cheaper arrangement then for people coming to the quarantine system in terms of how much they're charged for that?
I think there's a standard rate. We'll get that for you.
Correspondence with the Prime Minister's office, they outline a number of concerns such as they cannot direct airline companies to land in Toowoomba like they can in Howard Springs. And also there's concerns that Toowoomba lacks an air traffic control tower at the airport, so overseas planes might not be able to land there. That's their concern.
There was one that landed. Yeah, thanks. No, that's a really good question. There was one that landed there yesterday, or took off when we were there yesterday. So it is an international airport. It is a state-of-the-art international airport.
Are there customs and border protection controls at that airport?
I don't. Well, there must be for the international cargo cruise
So
coming
you
in.
don't
I'll
know
check
if
that.
there is customs officers there?
I'll find out for you.
What would be the cost of using a helicopter to get people to Brisbane hospitals, and also the cost of ambulances to Brisbane?
Well, I don't have that. That's just a normal part of procedures we have right across the state. Sometimes we had to airlift in. Remember that marine cruise from Weipa down to our hospitals here? We do that across the state.
Lifeflight says they can't take COVID patients, so would we be able to chopper people to Brisbane hospitals?
We have a whole range of aircraft at our disposal to do these jobs. We've been doing it now during the pandemic. It is not an issue.
The AMA.
It's a lot shorter from Toowoomba to Brisbane than it is from Weipa.
The
The AMA's put out a press release saying, in regards to WellCamp, aeromedical retrieval magnifies the risk of spreading COVID to the healthcare workforce. Have you looked into some of those concerns about?
Yeah, we've looked at all of that, and we've looked at Howard Springs. We're getting on with it. We're building it.
Once it's built, do you think Pinkenba will actually be needed anymore?
If we have both, that means we wouldn't have to have hotel quarantine.
Are you concerned that it'll turn into a white
Two's
elephant?
better than one.
Are you concerned it's going to turn into a white
No,
elephant?
not at all.
Why?
No, not at all.
Why?
No, because there's a whole range of uses that. Well, are you concerned about Howard Springs? I'm not concerned about Howard Springs, so why would I be concerned about WellCamp?
Based on the timeline,
Going it alone on WellCamp, what does it say about the unity of national cabinet?
I don't think it says anything about the unity of national cabinet.
Is it a united national cabinet still?
Sorry?
Is national cabinet still?
We've got another. I'm looking forward to the national cabinet meeting. We've got another national cabinet meeting today.
Why didn't you
I
tell
always
the
look
Prime-
forward
why
to
didn't
them.
you tell the Prime Minister before the announcement yesterday?
Sorry?
Why didn't you tell the Prime Minister about this new facility?
Well, he doesn't tell me a lot of things that he does either, Jack.
Have you got that updated modelling from the Doherty Institute yet? Has it-
Look. When I left work, it hadn't come in, so hopefully before National Cabinet, I'll be able to see something. But I'm looking forward to actually hearing from the Doherty Institute today at National Cabinet. I think it'll be very interesting. So looking forward to the discussions today.
Are you considering including 12 to 15-year-olds in the modelling for when we reopen at 70 to 80%?
I'll be looking at that today. I'll be asking some questions, so I need to get the briefings first. But it's we definitely need those 12 to 15-year-olds as part of the vaccination.
Some people on the Gold Coast also say that moving the checkpoint to the Tweed River would cut Tweed residents south of the river off from their own hospital. Would you be open to considering other proposals, or are you specifically looking at that?
That is what we put forward, and it was rejected by New South Wales. We actually put that forward.
What for the Tweed River?
Yeah, we put it forward,
Are you
and it was
worried about
rejected.
those
I think there's
being
people in the
left
Tweed that don't think that we put that forward. So I'm making it very clear today, we put that forward and it was rejected.
Premier, based on the timeline of both quarantine facilities, when do you expect to fully be out of the need for hotel quarantine? Do you have a timeline?
I don't have a timeline on it. It depends on when the second facility, the Pinkenba one, would be completed by.
Are the practicalities of moving the border south possible to overcome? Would New South Wales have to patrol along the border with Queensland Police to be able to operate within that?
It would have to be a joint operation. My understanding is that they worked out some agreement between, I think it was New South Wales and Victoria. We're open to have some sort of agreement between. I mean, these are communities that are so intertwined. So, and also too, let's see what happens over the next few weeks as well with the situation in New South Wales in regional parts of their state. I don't know the answer to that, so that's an issue for them.
Is there any more news on the Afghan evacuees?
Sorry?
Is there any more news on the Afghan evacuees coming to Queensland? Has there been any
Yes, we've been approached to accept more, and we've said yes.
Can you give us more details?
Look, I just have to double check if I can give further details. But any request that's come through from the Commonwealth about taking refugees from Afghanistan, I have said yes to those requests.
Are we taking injured?
Let's do a couple more.
Sorry, are we taking injured evacuees and asylum seekers from Afghanistan?
I don't know that. I don't know that, but our hospitals are available if there's any treatments that are needed.
Premier, are there any concerns that once this 2-week pause is over that we're going to have a similar situation again, that we'll reach capacity again and have to have another pause on that hotel quarantine system?
Jack, I don't know the answer to that. So, I mean, we are going to look at the hotel capacity, and then people will have to check in. So there will be a certain number of, thousands of beds available, and then people just have to book in. So once people have done the 2 weeks, they move out and other people move in. So it'll be like a rolling cycle.
Yeah.
Yeah.
Can I stop the young?
Yeah, sure. Okay.
Dr. Young, you're set to become governor on November 1. Are you still confident that you'll be able to take up that position on that date based on the vaccine rollout? I think you were saying you wanted to delay your appointment to that position until the vaccine rollout was at a level that you were comfortable with.
I'm very, very comfortable that I'll be able to take up that position because I've got a fantastic team. I mean, it's lovely for people to think that I've had such a key role, but actually it's been a team. and they are very, very good, and they will take this on 1st of November and deal with whatever is happening at that point in time.
Premier, you've chosen a famous student bar to mark this occasion. Would there be any chance of you doing a Jaeger bomb or something similar to mark the good news?
Definitely not.
Are you shouting